There's an important provision related to Medicaid that's ending next month. You might remember when the federal government put into place what's called the continuous enrollment provision. It came about at the start of the pandemic and was meant to protect recipients from losing coverage. It required states to ensure continuous enrollment in Medicaid in exchange for federal money. Well, starting April 1st, states will again have the ability to disenroll people from the Medicaid program. At least 300,000 North Carolinians could lose coverage when that happens. That's what we heard today from Representative Donnie Lambeth, a Forsyth County Republican. He says the way our state handles the process will determine how many people will be able to maintain coverage. That's why lawmakers are considering a bill right now that would expand Medicaid. If it becomes law, 600,000 more North Carolinians could be eligible. WFMY News 2's Daniel Cruz got reaction from groups that would feel the impact.
Advocates say expanding Medicaid would not only insure hundreds of thousands of people, but it could also lower health care costs for those already insured. Peg O'Connell leads the Care for Carolina, a statewide coalition for Medicaid expansion. She says their organization has spoke to people across the state who don't qualify for Medicaid, some facing thousands in medical expenses after foregoing care because of their out-of-pocket cost. O'Connell says expanding Medicaid would provide more access to critical preventive care.
So this will give them a chance to actually have an option for health insurance that'll help them have more physical security as well as financial security.
The bill headed for the state Senate would provide Medicaid coverage for 600,000 North Carolinians. $1.5 billion in funding would also be made available from the federal government, funding for rural hospitals, as well as implementing new programs to train people for new jobs. As the bill makes its way to the Senate, Senator Michael Garrett is confident both parties can find some common ground, ending a decade-long debate in the state legislature.
I think you have proposals from the healthcare industry, proposals from members of the House, the Senate, and advocates. So I think people are talking, having good conversations, and I'm optimistic that this session we will finally expand Medicaid.
Senate Republicans are expected to request some provisions with that bill that would send the bill back to a bipartisan committee of House and Senate members. They would work to come up with a consensus on a final version of the bill before sending it back to the floor for a vote. Both parties expect the process to move quickly with an April 1st deadline to take advantage of the additional federal funding.